Hello, my name is Emily Z, and I am excited to introduce our guest, Dr. Dennis Hsu, EP, electrophysiologist, cardiologist at Regents Hospital, and professor of medicine at the University of Minnesota Medical School. He is an incredible researcher with over 100 scientific publications and is renowned for pioneering the PVC, premature ventricular contraction radiofrequency ablation. I cannot thank him enough for this opportunity. As an EP, Dr. Hsu performs cardiac arrhythmia ablations. This means that he performs procedures that stop and fix abnormal rhythms of the heart. Dr. Hsu will meet with patients to discuss possible treatment options and follow up with them over several months to review their recovery. He works with a large team, including nurses, ECG techs, fellows, and other physicians when overseeing care. With Dr. Hsu's history as Director of Cardiac Arrhythmia Services and EP Labs of Health Partners, we wanted to address his ability to communicate and lead his department. Likewise, we also wanted to address his work with his patients. These questions will focus on Dr. Hsu's method of health communication with his patients and team. What encouraged you to work as an EP cardiologist? An EP cardiologist helps patients with heart rhythm disorders. The heart beats too slow, too fast, or irregular. Cardiac arrhythmia is a common health problem that can affect a large population, from the young to the very old, and could lead to symptoms of palpitations, rapid heart racing, lightheadedness, loss of consciousness, stroke, and even sudden death depending on the underlying causes. Although scientists have been exploring the mechanisms of cardiac arrhythmias for over a century, the true breakthroughs that occurred since 1980s have made effective and safe treatment available to patients. The field is progressing rapidly and benefiting more and more people. It is a medical specialty that requires the mastery of the state-of-the-art of technology with an operator's dexterity. One example is the catheter ablation technique, which offers highly effective and safe therapy for individuals with supraventricular tachycardia, atrial flutter, and atrial fibrillation, even as an outpatient. The other example is the implantable cardiac defibrillator, which not only prevents sudden cardiac death, but also significantly improves the quality of life in patients with heart failure. This is a very exciting field, where my services will not just be comforting and treating patients, I will actually cure cardiac arrhythmias for the majority of them. What 3 traits do you think are key for your occupation? I consider the following 3 traits as key for a successful cardiac electrophysiologist. Number 1, a desire to learn the newest science and technology constantly in the field. The knowledge of cardiac electrophysiology is expanding exponentially in the last 3 decades. Learning the recent discoveries and advances are not just important, but also interesting. Some academic findings actually could have immediate clinical applications. This makes the learning process interesting, as you will witness the direct impact on your own patient care. Number 2, approaching the data meticulously. In analyzing patients' data such as ECGs, device interrogation, and the time unit used in EP is commonly in milliseconds. Minor mistakes or admissions could lead to a totally different diagnosis and negatively impact the outcome of the procedure. And finally, number 3, perseverance. EP mapping procedures could be very long and detailed, and the ablations are not always successful on their first attempt. The nature of this specialty requires the operator to be patient and persistent in his/her quest to safely eliminate the arrhythmia focus. Health communication is essential in order for there to be effective health care. There are many factors that ensure that communication is successful, a little of which we discussed in Dr. Hsu's interview. Both verbal and nonverbal language send key signals and cues between conversers about their intentions and meanings. Ensuring that patients have incentive, understand risks, acknowledge benefits, and have confidence about behaviors is key when encouraging healthy lifestyle changes. Through meaningful communication, healthcare professionals can work together and with their patients to improve overall health. Thank you so much for listening to this podcast. I hope you enjoyed this session with Dr. Hsu.